NHS workers can expect pay rises if they agree to a deal struck between most unions and ministers. It follows a pay cap imposed for the last 5 years and a pay freeze before that. The deal will see wages increase between 6.5% and 29% over the next 3 years, with the exception of doctors, dentists and senior leaders. The biggest rises will go to those on the lowest end of the scale: cleaners, porters and catering staff, who'll see an immediate £2,000 added to their pay packets this year. The salary increases are expected to cost around £4 billion, but they won't come out of the NHS budget. They'll come from the Treasury instead. Our political editor, Laura Koonsberg, reports.
Porters, paramedics, nurses who care for millions of patients. The staff who keep the NHS going are finally to have a bigger pay rise.
It's nice for us to be recognised for all that hard work, but obviously it doesn't detract away from the last few years where we actually haven't had anything.
Most of us live on a strict budget. That can ease off a bit, and future will look better and brighter.
I have two young children, so having this pay rise will help out even more with childcare, things like that, be able to do more things.
For 5 years, there have been calls to do just that. Aside from some automatic rises, the limit on public sector pay increases of 1% meant wages fell behind.
Secretary of State for Health and Social Care, Secretary Jeremy Hunt.
And the election left the Tories in no doubt about the irritation. So,
today's agreement on a new pay deal reflects public appreciation for just how much they have done and continue to do. Rarely has a pay rise been so well deserved for NHS staff who have never worked harder.
When a nurse pleaded with the Prime Minister for a pay rise on national television, she was told there was no magic money tree. So can he tell us how this pay rise will be paid for? Has the Prime Minister's horticultural skills grown said magic money tree?
Taxpayers' money for the rises will come from the Treasury to start with, not out of existing health budgets, so the big unions are on board.
It's not solved the problems, it's a start, and we would expect it to be the start of a new process that recognises the hard work of our nurses and our people who work in our health service, that recognises the value and that we value those people for what they do.
But staff still have to approve the deal, and with inflation, it might not make up the difference.
I think the devil is in the detail, and our members that met yesterday were absolutely going through the details and couldn't see how this was going to claw back years of pay cuts.
Perhaps for NHS staff in England, these rises can't come fast enough. Remember, limits on pay have been in place for years, part of the Conservatives' efforts to balance the nation's books. But public money will still be tight. This is an easing of a squeeze, not the end. Scotland and Wales are likely to follow the Westminster move, and it adds volume to calls for rises in other parts of the public sector. Money round here is still tight, but the cap no longer fits. Laura Koonsberg, BBC News, Westminster.
The Foreign Secretary has compared Russia's staging of the World Cup this summer to